Health insurance in the United States is often seen as a safety net, promising peace of mind and protection against the high costs of medical care. Yet, as Neil K. Shah reveals in his eyes-opening book, Insured to Death, How Health Insurance Screws Over Americans and How We Take It Back, that promise is frequently broken. The book has quickly become Amazon's #1 new release in health insurance and is a must-read for all patients and physicians. The author's unique perspective comes from building Counterforce Health, the leading AI company helping patients and clinics fight denied health insurance claims through well-crafted appeals strategies. And from his work leading Care Yaya, America's highest quality, affordable senior care platform. In the book, Shah lays bare the inner workings of a system that routinely denies claims, delays care, and leaves patients and doctors entangled in a web of bureaucracy. Through meticulous research and real-life stories, he exposes the ways in which the health insurance industry has prioritized profits over patients, and he offers a roadmap for reclaiming control. At the heart of Shah's critique is a startling statistic. In 2023 alone, health insurers denied 73 million out of 392 million in-network claims. This is not a fluke, but a sharp increase from previous years, reflecting a troubling trend. Shah identifies a key culprit, a strategy he calls delay, deny, defend. In this playbook, insurance companies intentionally delay processing claims, deny legitimate medical requests, and force patients or providers to jump through endless hoops to get the care they need. The result is more than just inconvenience. For many patients, these denials mean postponed treatments, financial hardship, and growing distrust in the very system meant to protect them. So why does this keep happening? Shah argues that the complexity and opacity of the US health insurance system are by design. Insurers use jargon-filled policies and fine print to confuse consumers, making it difficult to understand what's covered and what isn't. Prior authorization requirements, where doctors must get approval from insurers before providing certain treatments, have become a major barrier to timely care. Even when prior authorization is granted, insurers may still deny payment after the fact, citing technicalities or medical necessity standards that are often arbitrary.
Despite these challenges, Shah insists that patients and healthcare providers are not powerless. One of the central themes of Insured to Death is empowerment through knowledge and action. Shah provides a step-by-step guide to fighting and appealing insurance claim denials. The first step, he says, is to carefully review any denial letter. These letters must include the specific reason for the denial as well as instructions on how to appeal. Understanding the insurer's reasoning is crucial. Sometimes denials are due to missing documentation or simple administrative errors that can be quickly corrected. Next, Shah recommends engaging in the appeals process with determination and diligence. Patients and providers should gather all relevant medical records, letters of medical necessity, and supporting documentation. He highlights the value of peer-to-peer reviews, where the treating physician speaks directly with the insurance company's medical director to make the case for coverage. This can be especially effective in complex or nuanced medical situations. Shah also emphasizes the importance of knowing your rights under state and federal law. For example, the No Surprises Act provides protections against unexpected medical bills and requires insurers to offer a clear process for disputing denials. Patients should not hesitate to escalate appeals to state insurance regulators or seek legal assistance if necessary. Persistence, Shah argues, is often rewarded. Many denials are overturned on appeal, especially when patients are well prepared. On a broader scale, the book calls for collective action. He points to recent pledges by major insurers to reform prior authorization and streamline coverage reviews. While such commitments are a step in the right direction, Shah cautions that real change will require continued vigilance from patients, doctors, and advocates. By sharing their stories, demanding transparency, and holding insurers accountable, Americans can push for a system that truly serves the public good.
In Insured to Death, Neil K. Shah delivers both a searing indictment of the status quo and a hopeful blueprint for reclaiming healthcare justice. Through his work building Counterforce Health, a leading AI startup helping thousands of patients and healthcare providers fight denied health insurance claims, he has a front-row perspective on the tragedy of our broken system and what can be done to fix it. Through practical advice and a call for collective action, he empowers readers to fight back against a broken system and to envision a future where health insurance truly means security.